Okay, I'm back. Let's see if it's going to work. I don't know why. So Dr. Greg Brannon of Optimal Bio is going to join us to talk about testosterone as relates to women and why testosterone is so important and how to raise it and when to know if you need to be on it as a replacement. Go live. I said yes, guys. I'm not sure what the deal. There you are.
Hello, thank you very much. My daughter's a genius.
Always, right?
Yeah, exactly. Thank
The
you so
daughters
much.
are always the geniuses.
Thank
All
you.
right. All right, guys, this is Dr. Greg Brannon with Optimal Bio. And, you interviewed me you guys, you and I talked once, and you taught me a lot of interesting things about testosterone. Some of it was even pre-recording. And I posted recently some stuff, some Q&A, and a lot of people are confused and want help around testosterone, especially women. And I thought, who better to answer some of these questions and talk about what is testosterone and why does it matter for women? Because I don't think that actually gets talked about enough. And it's actually been 3 male physicians who do hormone replacement and, who are friends of mine or meeting you professionally this way, who all brought it up to me and were really pounding it, like saying, no, you guys are forgetting about testosterone. And what I've noticed is a lot of women, hormone specialists, they talk a lot about progesterone and estrogen, but they don't even talk about testosterone very much. So I do know there's a little bit of controversy with replacement, and FDA hasn't approved it and all that. So I want to talk about that mostly, but also I loved what you had to say about your results in your practice with men with PTSD and using testosterone replacement just to help them because you want to optimize their hormones, but watching the dramatic reduction in their PTSD symptoms with testosterone replacement. And it wasn't a connection that I had made really, but it makes perfect sense. So I'd love you to introduce yourself to everybody and tell them where you are. And I'm going to ask this up front. Are you taking new patients?
Always.
Okay, great. Because people all ask me,
We
well,
have
where do I
5.
go and who do I see?
We have 5 offices in North Carolina and Virginia. So yeah, we're all throughout the states, and always we've been doing Zoom conferences across the nation for 5-6 years already. So we love doing this stuff. But myself, I've been OBGYN. I've been trained for over 30 years. Had a wonderful practice. I loved OBGYN. And then I also got board certified a fellow in integrative medicine A4M. I just saw in my OB practice women asking these questions, and the answer was always birth control pills and Prozac. And by all the FDA approved stuff you talked about, our body's wonderfully made, and that's not what we're lacking. But if I ask a woman, not even a woman, I ask some doctors, a reproductive age woman, do they make more estrogen or testosterone? The answer is always, well, of course, estrogen. The other one's a male hormone. A woman makes 4 to 10 times more testosterone in her reproductive age than estrogen. And we had to blow through that. It's an androgen. I have androgens, I have estrogens, I have some progesterones. You have androgens, you have estrogens, you have progesterone. It's the ratio of those, but we have them. And again, let that sink in. A reproductive age woman makes 4 to 10 times testosterone than she does estrogens. So if you're going to replace hormones in the menopausal age, why would you not replace all of them?
So that is kind of mind-blowing, right? I'm like, what do you mean? So you mean like I've been making, how am I making 4 to 10 times more testosterone? I guess that I make of my own estrogen, but I know you are making way more testosterone than me.
Yeah, we're making about 8 times more than you. But again, your ovaries and your adrenal glands make estrogen and testosterone. In fact, estrogen comes from testosterone.
Right.
It's aromatase. They go back and forth. So that's what's, and their precursor is cholesterol. So when I hear a bad thing about cholesterol, it drives me crazy because cholesterol is the precursor to about 25 structures, 80% of your brain, every sex steroid. It's 50% of every cell membrane. So when I go to the whole pathway of steroidogenesis. But yeah, this is crucially important. So if you you're a Ferrari and you stop running your Ferrari and your Ferrari stops. You call me up, you go, Greg, I washed it. I waxed it. I armor all the tires. I put air in the tires, but I'm not driving. It ain't moving. I say, have you checked the gas tank? Because that's what testosterone is. It's the gasoline. It's the fuel. And we need this stuff. Testosterone has over 400 functions in your body and my body. Estrogen has about 350 functions in my body and your body. So it's crucially important we have to replace these levels and not levels for your age. That's insane.
I love this.
Yeah.
Say that loud and
Yeah.
explain this, because
Good.
I am so sick of my 60, 70-year-old patients who say, my doctor says my levels are normal. And they're still displaying all the symptoms of low testosterone, and their doctor will not help replace it.
Because this whole idea of what ranges, first off, is where do these ranges come from? Most studies are on 10,000 people within that time frame, right? So if we're getting 10,000 samples from 10,000 sick people, it's irrelevant what the bell curve is. So you start looking back what a range was 30, 40, 50 years ago, it was significantly different. I'll just give you an example. June 30th of 2016, LabCorp's range for testosterone in males was 350 to 1197. On July 1st, they changed it to 264 to 916. Women's ranges were about 8 to around 70, and then the next month, they were down 3 to 41. So the answer is why? And this is really important. We've talked to our thyroid. If we lose our thyroid production, do we replace it based upon our age or what is optimal for metabolism? What's optimal for metabolism? If we lose insulin, do we replace it for age or what is optimal for metabolism? First, optimal for metabolism. We lose our gonads, which is like, part of aging, suck it up. It makes no sense. And that's why it's important to have the optimal range and everybody's individualized. And again, what's really important is you don't treat ranges either way. Those are our guideposts. You treat symptoms. Is your sleep better? Is your cognitive better? Is your muscle mass going? When you and I age, we're not going to be 80 years of age ago. I wish I had less muscle. The number 4 cause of death over the age of 60 is falling down. That's why it's important now to build that muscle, do the squats. It's crucially important. Our brain power is there. So this idea of range, and I go through the FDA, the number 4 cause of death in America is medical treatment. Why would that's not our standard. Our standard's got to be optimization of the individual. And then when our body gives us these complaints or symptoms, they're not make-believe. Our body's screaming for help. We got to look for what the help is, and it's integrative. Brain
Let me ask.
Yes.
Let me say that. So let's talk about how would somebody know they might have low testosterone and say, I need to find somebody to help get, do I need this? Because I think there's a whole host of symptoms. Like you said, you mentioned, birth control pill and Prozac, that gets chalked up to, she's just anxious and depressed, and let's give her, let's call her, mentally ill instead of, and right now I understand these things apply to men, but I do want to kind of focus on women as much as possible, and maybe just talk about what should women look for or know what to ask their doctor.
Real quick, I want to go back over this. You said something about in their head. So every body part is named in Latin. A uterus is a Latin term, that's what it's from. But if you surgically remove it, it's in Greek. It's called a hysterectomy, not a uterusectomy. The root word for hysterectomy is hysteria. So they thought they could make a woman stop being mental by taking out her uterus. They thought it'd spread throughout her body. So there's a biasness here already. So there's some biasness here. So when you talk about this idea of what optimization is, it's very important, again, to listen. That's the most important job you and I do. It's not talking. It's not our education. It's listening. And then what separates us from our patients, will say it, is, I even like that word. I want to be in their journey with them. It's their journey, not my journey. Is that we have certain language that sometimes separate, that we know so much more. So I really want to spend time. I believe our job's educator, so that the person can make an informed consent to what's best for their body. And I believe that's what our job is. And part of it is like not even knowing, I'm a woman, I make testosterone. Yes. There's I forgot the name where the paper came from, what journal it was, but they looked at treating menopausal women for their symptoms with only testosterone. And 77% of all symptoms, from hot flashes to vaginal dryness to cognitive, were removed with testosterone alone. Testosterone, there's more receptors of testosterone in breast tissue than there is estrogen and progesterone. So this stuff has
That's
to come.
crazy that we don't know that.
Right.
And I'm a woman and I'm in holistic health and I didn't actually know that. You know, it's really amazing how much it's not explained. And I'll tell you, and I think I told you this, and for the viewers, this kind of all testosterone happened personal for me. I'm 48. Things are a little bit different. You know, I've gained a little bit of weight. My sleep has been jacked. You know, my period's a little bit more clotty, right? It's like, okay, like this might be a perimenopause. I probably need to run some numbers, right? I need to say where I am. My last big hormone panel was like 3 years ago, and I was still ovulating and everything's still on point. And the last 8 months or so, there's something different, right? I can feel it. And now looking at the symptoms, I called a friend who's a physician like you, a man, and he's a bit like you, fit, lifts the weights, all of the stuff. And I called for, you know, Michael, I think I need to up my peptide game. And, you know, we're in a peptide epigenetic training forum together. We talk genetics and peptides and all these new fancy things. And he's so great at bringing it down to basic. And he was the first thing he says, like, I think the first thing we need to do is look at your hormones because you probably just need testosterone. I was like, what?
Yeah,
okay.
a 40-year-old woman has 50% of testosterone gone by the age of 40. I love peptides. So when you talk about that later on, I love it but they work synergistically. That's why thyroid, sex hormones, insulin, well, basically not insulin per se, it's our crappy diet leading to hyperinsulinemia, not the insulin itself. They all synergistically work together. And that goes with our diet, with exercise. But yeah, testosterone, I stress a lot. I believe all of us are Bugattis or Ferraris, whatever you want to say. And I use the term that our testosterone is literally the gasoline. You need the thyroid for the combustion. I understand all that. But without the testosterone, you lose. Again, something our body makes from in the womb. That's why they're called sex hormones. Is because the estrogen and testosterone causes the genitalia to either become a boy or a girl part. That's where the word sex comes from. It's not the intimacy part. It's the actual anatomy and physiology part of it. So now and then on top of that, there's benefits. Again, you said you're 48. I thought you were 28, but that's a whole nother story. So good peptides. But again, look at this. Menopause, we lose bone. A woman loses 5% of her bone every year in menopause. 50,000 women a year die of menopause. Their hip breaks, then they fall down, then they die of pneumonia. Not knocking breast cancer, but it kills 40,000 women a year. We don't see things about that osteoporosis. But if a woman takes testosterone bioidentical and bioidentical estrogen, they make 8.3% of bone mass per year, regardless of age. So there you'll never have osteopenia or osteoporosis. Men also have osteoporosis.
And everybody wants to talk about growth hormone without talking about testosterone. So it's like, we have these bone enhancing, testosterone builds bone density. It builds muscle. We all know of that. Right. And I got to tell you, there's nothing more demoralizing for an aging person whose all their workout efforts are not doing anything suddenly. Right. You're like, why is nothing happening?
and if you look at growth hormone, we do lose that with age. But what's interesting is growth hormone makes IGF-1, which makes somatostatin, which turns off that axis. It works great. But IGF-1 utilizes, what does it utilize? T3 and testosterone to do its function anyway. That's why before I start people on the peptides of growth, CJC and things like that, I always want to optimize their thyroid and optimize their testosterone, estrogen, progesterone. Because again, it's synergistically here. My wife is very petite. She's 5 foot tall. Her bone strength at 57, her bone's probably stronger than most 30-year-olds because she started in her early 40s and went right. My wife has no idea what a menopause symptom is because she never ever had that because as we saw the whole levels change, she increased her dosage of the hormone she needed. Boom, continued, and we have about 8,000 patients in our practice that we've seen that occur. Again, what drove me to this was beautiful. Mid 30, early 40-year-old women in my practice, my OB practice, complaining this. And it just did not make sense to me that the treatment is a synthetic molecule, ethylene estradiol, or levoprogesterone, or the worst, Provera, and then a SSRI. It just doesn't make any sense to me. And that's what the FDA recommends for menopausal women is SSRIs. Like, it's crazy. It goes back to the whole hysteria stuff of the hysterectomy age. Just for that reason, it makes no sense.
Right. Okay. So symptoms, I kind of said them to you,
Okay.
right? So what women would look for, my sleep wasn't good.
Well, it depends on what age.
Okay, let's talk about it. Let's talk about. So we have people, you guys, we know perimenopause and menopause. Things are going to happen, right?
Right.
I will say my assertion is we are aging prematurely, very unnaturally from our lifestyle. I question perimenopause and menopause as even being normal anyway, because there are some tribes all over the place.
Yes.
There's people in Siberia having babies at 60.
Right.
This is a fact.
Right.
So kind of like, it's really interesting. So there's that. So I'm a big fan of hormone replacement because I don't think it's natural. I don't think I think we're depleting ourselves in a very unnatural way for whatever number of reasons.
Right.
Even connected to nature, toxins, poison, stress. I don't know exactly, right? So there's that. But then I do know, of course, and you can speak to this, the number of 20 and 30-year-olds I've seen in my practice with aberrantly low hormone levels across the board has been stunning to me. And they're getting misdiagnosed with a bunch of mental illnesses, basically coming to me for anxiety, depression, PTSD, panic disorders, and things like that, where it's really always just been a thyroid disorder or a estrogen testosterone imbalance. And those are the things I do refer out to somebody who does that while I work on the brain component, right? Because they influence each other, but I can't prescribe and don't understand that. And I do the brain therapy part. Right? We do it together. And I know I can't fix that brain. I can't do anything to it until the hormones are right. And oftentimes I might not even need to do my job because that symptom could be completely gone,
right.
So it's an interesting thing. So why don't you talk, you can, whatever you want to talk about in terms of the younger cases, but why I really want women to hear, and I know men, they know if they don't wake up with an erection, guys, you have a problem. I mean, it's kind of simple for men. I literally just had a conversation with a patient at 61 yesterday. He's like, well, how do I know? I'm like, if you aren't waking up with a woody, you need help. I'm going to tell you right now, it's pretty simple for you. Your wife has we're a little bit different on how what we're going through.
Yeah.
So what would you say for a woman, like what's going on? Why should they call you? Because what I want is some women who are suffering to call you.
Yeah. Real quick with men, most men issues isn't even that. If they're tired and their words, brain fog, that's the number one thing even for men. So women, I have women from 18 years age to 92. So when we have these ideas of anxiety and depression when they're young, it's like, what's going on here? And that's why you talk about testosterone being low, because you know to test that. So anytime I have any emotional, mental issues, I want to see how the brain's functioning with the gut. They go together hand in glove. So what we look at is there was a great paper from the NIH in 2013 in both men and women, regardless of age, that testosterone actually helps better than anything else out there, because it helps the neuroplasticity in the brain talking to each other. But the symptoms, if anything, you feel run down, you just feel like you're not yourself, I believe you should check your testosterone and your progesterone, your estrogen, regardless of age, and see where you're at, as well as the thyroid, because that works synergistically with that. So when you look at the symptoms, that's it. Also, low libido in mid-20-year-old women. That's very common now. I think the Lancet paper did a study. This is about 3-4 years ago, that said 47% of cohabitating couples were intimate once every 3 months, and they consider that within range. And it's just because we have a sick population. So you check these values, they're going to be sick. UNC Chapel Hill did a study last summer, said 12% of Americans are metabolically healthy. You talk about the aging purposes before. Do we age because we lose hormones, or do we age and then we lose hormones as we age? I think hormones actually a reason why we can't stay young, and not just young. We're not talking skin. We're not talking, the looks. That is a byproduct of that. But the way the heart pumps, the way the brain thinks, the way the bones are made, the way our body functions. I think we have our longevity and quality curve could be like this instead of like that. And so symptoms are the number one symptom, regardless of age. I'm tired of being tired. That's it. That's number one. That gets me down my journey. And then based upon age, if they're menopausal, we could have vaginal dryness, hot flashes, those kind of things as well. So that's what we're looking for here.
Okay. Yeah, that's it. And when you say that, of course, I always look at, I'm looking at neurotransmitters and
Right.
amino acids a lot.
Right.
You know, I'm like, I deal all that, and that could be, you know, low endorphins, low catecholamines, things like that. And so it's really a fascinating way to put it all together where I'm like, okay, to know, like I just had a 19-year-old who I've never seen one this tired, right? There's a lot going on. And even though I've ordered a Dutch panel and I'm waiting to see it, you make me think like, wow, do we already at this age have to support, you know, I'm going to be curious to see. So let's say,
well, here, let's stop right there. Because we haven't hit the elephant in the room. Why are we lower? How about just ask that one question?
Right.
Why are we lower? So FSH in women makes the egg make estrogen. The LH makes progesterone. LH is progesterone means pro-life, keeps the baby in the womb, plus has other functions as well. Now, the estrogen converts to testosterone with a hormone called aromatase. But what keeps all this going together is that when the numbers are great, the estrogen goes back to the hypothalamus and turns off the system. So it's high enough it turns it off. But what if we got estrogens from outside our body? Then we think we have more than we do, so we make less. This is the 40 years, 50 years of plastics, Roundup, atrazine, phthalates, dioxin, BPA, BPS, red dye 3, red dye 40. There's at least 200. Yeah, soy boys, over and over and over again. So we have they're called xenoestrogens or neuroendocrine disruptors. That's why we're lower. So we're not lower because it's healthier for us. We're lower because it's the environment destroying this beautiful body. This body can basically survive almost in any type of atmosphere or environment, but it could thrive when it's optimal. So we have to understand when we have these numbers. There was a study came out about 2 years ago that it looked at Western Europe, Canada, United States, New Zealand, Australia. Men under the age of 35, their sperm is 50% less than my generation's. We can't call that. Hebrew University, I said by 2045, men will be infertile in the Western countries. So the answer is, what are we doing? We know the cause. The cause are these synthetic plastics that mimic estrogen that turns us off. As you talk about soy, 99% of all soy is GMO on top of that. So yes, I'm with you, Doc. It's crazy what we're calling normal. We call something normal because it's common. So if everybody had cancer, we'd call that normal. Makes no sense to me.
Right. That's what I was saying. I think there's a number of reasons why we are prematurely causing this. I'm actually interviewing today, it'll be on a podcast, Dr. Anthony Gay, the author of Estrogeneration. So you guys, that book is extraordinary. It's actually on my list now of like required books.
It's phenomenal. It's phenomenal.
Especially for parents to read of children going into adolescence and puberty. Like, you need to start making these. He does an extraordinary job. Estrogeneration. Just if you want to know more of what Dr. Greg just talked about. So we have all these very, very strong, like fake estrogen toxins coming at you, basically, is one thing. We also have lack of sunlight because sunlight's involved tremendously. We also have the push towards a low cholesterol, low saturated fat diet, right? And that's the backbone of all these hormones, these sex hormones. I also think just the lack of hard work, right? Because we know doing hard work on the muscle, resistance training, right? Once upon a time, we used to plow fields and chop down trees by hand and fix our roofs and do all kinds of labor. I mean, nowadays, you know, it's a sign of status to never do physical work, right? You don't even cut your own grass. You don't fix your own anything. You know what I mean? And women in particular get pushed away or think that weightlifting is something they should be avoiding as if they're going to get bulky. So I'm a big advocate of trying to explain. Let's just maybe go through how can you naturally try to increase your testosterone. You could just run down those things, but I am an advocate for
the big thing is eating protein. I mean, Sean Baker's book, Carnivore Diet's phenomenal on that. Eating protein is crucially important. Eating nice, healthy fats are important, and then exercises. The studies have shown you can increase between 30 and about 100 points. The more squats you do, deadlifts like that. But when we're starting with such a sick generation, you can't make your gonads produce the levels your great grandfather did. And that's the biggest issue. That's why I think where the placement, I'm not saying we don't do the deadlift, we don't do those. I agree with all that stuff. And some people, Sean's done well without testosterone replacement. There's some that can do that genetically. I've had 6 men in 10 years of my practice who came to my office over 900. Okay, 900. Of those 6 men, all 6 were over the age of 60, and 4 of them were over the age of 80. They were farm boys who walked everywhere. They never did vaccines. They ate eggs every day, ate their meat. They were just at my office. They're wondering because their kids were here. And I said, you studs don't want to be here. So the question is, what can you do? But I do believe it starts with a real great diet of non-processed food. I do like some vegetables and fruit, but I love Sean's idea. I eat a lot of fat and meat like he does, but I still like the taste of watermelon and apples and stuff. But I do believe a high fat, high protein diet. I'm a believer in intermittent fasting. I think that's really important as well. There's some great studies on that to protect the mitochondria. I think everything we do, what you do at your job, we talked about this last time, is to protect the mitochondria. The electron chain transport is crucially important for that electron gradient to make the mitochondria healthy within the cell. When the mitochondria gets unhealthy, the cell gets unhealthy, and then the organ gets unhealthy. So I think it's all just ties together synergistically. But no matter what we do, health-wise, working out, I'll say 98% of people will not be at the levels that were their grandfather. And back to those ranges, I had to bring those ranges up. The ranges in the 30s and 40s were closer to 800 to 1400. That's what a male was.
Right.
A woman was between, say, 90 and 280, 250 in that range.
Yeah. I think I agree we should be using older numbers because all we've done is as the population has gotten sicker, you guys, we use a bell curve. And so now what my grandmother's level of healthy cholesterol and healthy testosterone, that's what I want you to use as my markers. Those are much more optimal than they are today. Okay.
Well, Doc, since you brought up cholesterol, again, when I was in school, anything over 330 of total cholesterol was considered high. Now it's 180. Right. LDL, same thing. The largest series looking at overall mortality was in Japan in 2015. They looked at 29,000 people, and they found the 2 markers for the longest for decreased mortality was a higher total cholesterol and a higher LDL. In fact, for every, I think it was 23 nanograms per deciliter of cholesterol, increased longevity like 4 years. So this is a fallacy. What causes atherosclerosis, according to Dr. Houston at Vanderbilt, he's phenomenal on this, it's an inflammatory disease. It's the lipoprotein, the particles that carry the cholesterol when they become oxidized by a high carbohydrate diet. That causes the endothelial damage, which causes the atherosclerosis. Dr. Miller, a famous cardiovascular surgeon, says, blaming cholesterol for atherosclerosis is like blaming a fireman who's at your house putting the fire out. Right. So that's why when you talk about your brain, cholesterol is crucial for the brain. Now, there's a subpopulation with high particle numbers that may need a statin, but then you take things that protect the brain like AANGT, you take coenzyme Q10, things that could actually protect the mitochondria from those downsides of the statins.
Yeah. Perfect. All right. So we're looking for optimal numbers, you guys, and you really need to see somebody who cares about holistic functional numbers because they're not going to be what the lab will have as a range of normal. We go, well, that's nice. I don't really care because that's actually not good. Right. So when people, I know you could probably go through it. I went to the doctor, he said everything's within range. I said, yeah, I don't care what you heard. I need to see the actual labs. Like, what's the number? Mm-hmm. And often, I'm like, yeah, that's not okay.
Right.
Like, they'll say your blood sugar at 124 is okay until all of a sudden it's 126 and it's not.
Right, exactly.
Till now we have a disease and we shouldn't wait till we have disease.
Right.
And that's where I'm at with my age, where I'm like, oh, okay, like, let's get on it. Let's see what's going on because I don't want to go down the hill and have it all of a sudden, which I have so many patients right now who are 60 to 70 some-year-old women. And all of them got the bad advice of that era of hormone replacement is going to cause cancer. Okay. So they didn't do it. So now they're all in the complaining space of, I have no muscle mass. I have really bad, saggy, loose skin. I have no collagen. I have weak bones. I'm trying to work out. I get no muscle results. It's so frustrating. My body fat's at 35%, 40%. And I'm carnivore for a year and I'm working out and there's not a lot of changes because now they're 68 and they have never had anything. And I'm like, you need to go see someone and they have no sex drive. They love their husbands and they want to have, they're like, I remember this, I want to do it, but I'm just telling you, I can't. Lots of brain fog, lots of memory issues.
Can we go over that? Can we go over that WHI study real quick? The 2002 paper that just wiped women out. In fact, Johns Hopkins went back to reviewed it and said the last 18 years, we lost about 19,000 women a year because of not being on hormones. Okay. But this is a very interesting study. It was 10,000 healthy women. And I want that important, healthy. Dr. Desai, a famous oncologist, destroyed this paper in 2002. 5,000 women dropped out. So now it's only 5,000 women. And they considered the average woman in the study was 63 and a half high blood pressure, a half smoked, and a third already had a heart attack. So how is that a healthy population?
Right.
And they gave them, and the Premarin only arm actually had decreased breast cancer. And Premarin is female horse urine, and even that had some benefit. The Provera arm, which is medroxyprogesterone, synthetic progesterone, had an increased breast cancer of 24%. So they stopped the study and said, that's it, hormones cause cancer. First off is they weren't estrogen and they weren't progesterone. That was Premarin and Provera. It was not estrogen. It was Premarin, equine estrogen. Now, Dr. Fiornero in France did two studies in 2005, 2007 with 134,000 women. Very simple study. He gave estrogen, bioidentical pellet, natural progesterone at bedtime, pellet of estrogen, and Provera. The bioidentical arm decreased breast cancer by 10% because it mimicked the young woman's physiology. The Provera arm increased breast cancer 69%. See, the problem with Provera is the progesterone receptor, natural progesterone, binds the receptor and lasts about 30 days. The synthetic one binds for over 6 months and turns it off. So therefore decreases it. To get really nerdy on this, when you say estrogen, which estrogen? There's 3 major estrogens in our body, in women's body, women too. E1, E2, E3. E1, there's these 2 receptors called an alpha and a beta. Alpha's pro-growth, beta's negative growth. The E1 is 5-to-1 pro-growth. The E2 is 1-to-1, and the E3 is 1-to-3 anti-growth. That's from placenta. So the E2 that dominates in young women is a 1-to-1 ratio, and in the breast tissue actually inhibits overproliferation. E1, which dominates in menopause, is a 5-to-1 ratio. Where's the breast cancers? Where's the strokes? It's in that arm. That's why it's also important to look at the endogenous one, see which one dominates. So again, and then you look back at the studies at testosterone. Then now they're taking testosterone pellets, implanting them around breast tumors, cancer. They're shrinking prior to surgery. So I can do this all day long. But when we have the natural stuff our body's supposed to have at the optimal levels, we have the best chance of fighting this environment to keep us healthy.
There we go. That's probably the best summation of it, right? I love how natural and fighting the environment, that we've done what we've done and we're all living in it and doing the best we can with the stuff around us. And you can make choices in your home. You guys can get estrogenation, and he outlines a whole bunch of steps that you can do. That's another talk, and I'll be talking with him, and that'll be coming out.
Well, tell him I love this book, and I bought a Berkey Royal filter as well, and he's the best. Yes, great book.
It is. It's an extraordinary book. So you guys, I look forward to posting that. You should get him on. That'd be a fun conversation. You should talk to him.
Well, thank you. We'll do that.
Yeah, I'll tell him about you. That'd be perfect. And because he's really taking a stance right now, on also just the like, we need strength again. And you know what? Testosterone brings strength and courage in such a way. There's a reason for it. And, I'm a mom. That's my son right there. Mm-hmm. And, I'm actually starting a podcast. It's called the Strongman Podcast. And it's really, and I would love to have you on that as well. I wanted to have this conversation, but as a mom, single, I'm divorced, raising a boy into a man, it's not a thing I really know about. And I do know boys need men to teach them how to be men. I'm not
Yep.
naive in that. And we really are missing out on rites of passage. And there's all of this stuff. I started writing a men's book for him. And I'm actually had to pause it and as I'm learning more. And I love talking to men that I see. That's what I'm talking about. I want
Yeah,
him to do
I
that.
I had no father myself. My mom had raised myself and my younger brother.
Yeah, I'm gonna have to have
Yeah.
that into the podcast. We'll have that conversation because I'm looking for advice on like how to raise a boy into a strong man. What do we need to know? And one thing we need to know and acknowledge is how to make sure he has a ton of testosterone. Because
Yeah, I agree.
I don't care what everybody. We won't get into too political and all this bizarre gender neutral as if X and Y and XX don't matter anymore. I don't know what world we're living in that as an OBGYN, you wouldn't need to know that data.
Mm-hmm.
And because it makes a lot of difference. That's where we're at. And the fact that I've got to teach him like, oh no, we've got to protect your family jewels in such a way. And it's because it's protecting his brain and it's protecting his ability to do what he was put on this earth to do. And I had to tell him when he was very little. So let me be real clear, because he had a lot of anxiety. He was very afraid somebody was going to come into the house and kill me.
I got it.
He would have nightmares. And then I had to kind of like, and I realized my mentor, my doctor, man, always a lot of men mentoring me, much older man, Dr. Belgard, he kind of had to explain to me, you're hiding too much. You're trying to protect him too much. That boy knows there's scary things in the world. So stop telling him it's fairies and unicorns. Like you're doing too much love and light, Mom. I know what, you've gotten real soft after having this baby. And I was like, no, man, I don't want him to think he's like, but there is, and he knows it. But you need to help him feel safe. You need to know who you are and what you can do. And I grew up in the streets and I'm kind of tough or whatever. And I said, oh, I don't want him to know about that though. And he goes, but he needs to. So I had a very brief conversation with him at like 7 or 8 in this house. Maybe he was about 9 at that point. And I had to just say, wait a minute, Bennett, let me be real clear with you. I just had a very frank conversation about what would happen if somebody walked into this house and how I would eviscerate them and I wouldn't think twice. And and I had to explain some things in a way that he was like, oh. I said, oh yeah, and my job was to protect you. But one day you will be bigger and stronger than me. And your job as a man is to keep your body strong and your mind strong, so you are resilient and you have the kind of capability and courage, therefore, to run into a burning building and throw me over your shoulder and get me out of this house. If you are not fit physically, mentally, you can't do that. So I think you have a responsibility to stay strong. Especially, I'm sorry, one day you're going to be bigger than me. You're going to be bigger than the children and animals around, and you best you're going to be a man that will be able to jump up and do it. And that's what he was like, yeah. And so I just went, do you want to learn how to box? He was like, what? I was like, yeah. So it changed everything to see like, wow, I've got this scared little boy afraid of things. You know what he's going to learn? He's going to learn to box. He's going to learn to throw knives. He's going to learn to do all kinds of things to grow into that. And Anthony Gay, you need to talk to him. He has a lot of that going on right now, and it ties into that. And it's not about toxic masculinity.
No.
It's about being who you really are.
Right.
Less like, you know what I mean?
Right.
It's really a wonderful thing right now. And I think the testosterone is a huge key that has gotten demonized, and we need to like kind of bring back.
I agree.
For women too.
I agree.
Right?
100%.
So tell the people, how would they come see you and what would that look like?
Our website is optimalbio.com. And like I said, we've been doing Zoom conferences and we get labs across the country, wherever you're at. And then if you need to, I try to find places where they live, they can find a pellet person there. But if not, a lot of them come to me, they fly in and we take care of them with us. But we have 4 offices in North Carolina, 1 in Virginia. We'll be spread across the Northeast and probably some franchise type things across the country. That's working. My daughter runs the company. But my big thing is we could always have this type of conversation one-on-one on Zoom every day. I do it all day, every day. And then we hear their story, get their labs, and we follow up. And we just really believe in taking the time to educate. And I wrote a book on this. We have a PDF version of the book. We'll send them to them immediately. And if you want a hard copy, we get that as well. fact, right now I'm in the process with a couple brilliant men putting together another more of a scientific book on why testosterone by hormones and why bioidentical is superior and why the mode of application, i.e. the pellet, is superior. We have 85 years of literature on that. So we're in the middle process of writing that book as well. So
you like testosterone pellets more than a cream, even for a woman.
it all has to do with pharmacokinetics. You can get a more constant, steady level over time. And they've been used in women since 1935 and men since 1937. A bioidentical pellet has never been recalled in any country ever. All right? But it has to do, the creams just can't get high enough, and you have to rotate the cream. The creams to me are my second favorite. Injections are fine too, but the problem is you look at Alzheimer's studies and things like that, you need a higher constant steady state so your levels stay steady over time. It's the pharmacokinetics of it is just far superior. It's like your body gets an ovary or a testicle transplant, and your body goes, whoa, what's happening? And it just does its work. But
so would anybody see you? So let's say I'm here in Atlanta and you aren't here and I don't want to come to North Carolina. I can't get there. Let's say for whatever reason I can't get there. And like I could see a local person and like let's say they're putting in pellets. Do people ever use you as like a second opinion consult?
I would say more of a first opinion. If they live in Atlanta, hope we'll be down there soon. We'll work on that. But that being said, I love to do this and just encourage them. We'll get all your labs. We'll have your conversation. We'll send you a book. So you know what to go look for in Atlanta. You know what to go look for in Los Angeles. Whatever you're looking for, you know what you want. And I'd still say 70% come to us the first time and they make it a trip. But I want them to be a very educated consumer. And then there are other guys out there and women doing pellets, which are great. Just find a person you want to go to, but you know what you're looking for, what numbers you're looking for. So I want to be the educator. I love that part of it. But yeah, our company itself is expanding and growing. And we just had a beautiful, we have a wonderful Dr. Beauvais up in Charlottesville, Virginia. She's a cardiologist who's trained in pellets and also peptides. She's preventive care cardiology. She's part of Optimal Bio as well. She'll be doing consults, Zooming as well. So we're going to be adding as we go along. But our goal is, my big thing is I always draw when I have my conference, I draw the hypothalamus to pituitary, and I draw ACTH and cortisol. I draw prolactin. I draw growth hormone, thyroid, LH, FSH, and growth hormone. I do it all so they can understand this. We spend 45 minutes or so talking about how it works, and then we get their symptoms, we put it together and get the labs. My follow-up consult, I don't charge for a follow-up consult. I have one fee forever. You can talk to me every day, all you want. I just want to make sure you're prepared to ask the right questions because remember, it's your journey, and that's what we want to do here. So it's optimalbio.com, and we can start seeing people Zoom in immediately. And but we have offices, like I said, across the state and in Virginia and expanding shortly further south and west.
Awesome. So there you go, guys. You know, it's really, really important that you take the time. It's fascinating how much, I got to tell you, Greg, women fight me on going to get their labs done. I don't know if it's just, I think they use money as an excuse, but I wonder if, I guess my own feeling when he said, your testosterone bill, I'm like, what are you talking about? My testosterone, you know, I don't know if it was the acknowledgement of like, oh God, did it happen? Like I'm aging and just the psychological that, or just we don't like being measured because of like tracking our body fat or our weight has caused emotional trauma. But I have a really hard time convincing, as usually women, that I needed labs. Like you guys, you need to see your numbers, and there's no shame in getting replacement or help. I don't know if that's what it is. So anything is there something you would teach me that you could coach me on, and they're gonna overhear us? How can I get women, to me it looked like, to love themselves enough to invest in this for themselves? I think it's profound.
Well, first off, the most valuable property you have is in the mirror. It's a bottom line. It's you, right? Schottenheimer, this Arthur Schottenheimer, he was a Prussian philosopher, said the three greatest gifts in life are not known while you attain them, and after you lost them, your health, your youth, and your freedom. Another one, James Madison's quote, is knowledge will forever govern ignorance. And that's why, to me, it's really important that I think your job, my job, is to be educators. So how can you make an educated decision if you don't know your numbers? And again, you talked about numbers, what's today's numbers or 50 years ago numbers. And that's part of education purposes. But if you're not going to put time, or especially, maybe, okay, women, moms, they always put themselves last.
Yeah.
It's always that way because they're going to take care of their husband, their children, their job, whatever they got to do, and then they pay the price. So I think it's really important to understand if you're not going to change who you are as the giver. You're not going to change who you are to Bennett. You're going to be the giver. That's who you are. But you can be a better giver the healthier you are, and the longer you're around while being healthy. And that's why it can be done together. And so again, you can't make a decision. You can't cut a board a round angle till you know it's 90 degrees. So you got to know the numbers, and then educate why we need to know numbers and what lab matters and why it matters. Why you use the saliva for cortisol, but blood for hormones, and why a Dutch cast comes in when you look at metabolites. That goes your genomics. That's very important for that. We can spend the whole time talking about how estrogen is metabolized in urine and how that matters. So all this thing goes together, but I really I'm just honored to be walking their journey. It's all I want to do is walk their journey. And because again, that's why I'm not going to say, well, your numbers now will make a number for a woman. Now it's 180. You should feel great. You know what? You may be at 242. I don't care. Your symptoms are going to be there that are going to go away. You go, wow, I feel more like me. And that's what I want to hear here. So I just want people to be educated, be the consumer. And just because they're a doctor, okay, does not mean they know everything, especially nutrition, all right? Especially physical fitness. We're not trained in that. Right. Every FDA-approved medication either blocks a receptor or destroys an enzyme. That's a cascade effect we got to think about. So therefore, if we can replace what our body used to make I have to think about vitamin D when I give vitamin D. Vitamin D affects 3,000 genes that we know about. Let it do its work. Same with testosterone. Go do its work. So what I just want to do is be the biggest resource we can to educate people, to empower them to go understand that the most important king and queen is in the mirror.
I love it. I love it. Most important king and queen is in the mirror. Perfect. Awesome. Well, you guys, optimalbio.com. Go ahead and follow, them on Instagram as well. Is it optimal bio or optimal underscore? I don't know.
Optimalbio.com. You're asking me a tough question on that, but
don't worry about it.
Okay, optimalbio.com. We have everything on our website. We have our podcast. We have your wonderful podcast. We have our Instagram. We have our book. We have everything out there. And again, I love to do this kind of stuff with our patients, Zoom in and get it going. I want to get people knowledgeable.
Yeah, perfect. And you guys, he looks amazing. His family is awesome. He's really a great truth teller, and he's, no kind of BS, and understands looking at the change in the labs and the numbers, and how the FDA really isn't the end all be all of who we should be trusting anyway.
Right.
And if you don't have that level of healthy skepticism or cynicism as a physician, I deeply question you as a physician.
Well, to be fair, also we have our book. It's called the Hormone Handbook, written by Greg Brannon. It's on Amazon. You can get it there and get started, get a hard copy, because as you know, the best part of that book is the back page, me on my paddleboard. That's a joke.
Yeah.
But get start reading and read other things. And I really want to challenge people to read why BHRT is not good. Read all the contra stuff as well. Go shackle it all, because I'm going to see them prove that why it's not superior, because we know it is. And I love the Socratic method. Let's go for it.
Yeah. I kind of look at it, I'm like, oh, the FDA doesn't like it. We must be on the right path.
Yeah, exactly.
Awesome. Thank you for sharing your time with us. And I'll upload, and, you guys check them out. You really, really deserve to look at what's going on with your body, and getting started sooner is much better than when everything's already fallen apart. It's a lot harder to build bone density. It's a lot harder to build muscle back than just stop it from falling apart.
Exactly.
Okay. Have a good one, Greg.
All right, Doc. Thank you very much.
Yeah.
Bye-bye.
Bye, guys.
Bye-bye.